With prostate, there's two general categories. You have the benign enlargement versus prostate cancer, and you can have either or both. The best way to screen for those two areas is through digital rectal exam, PSA, and sometimes prostate ultrasound.
When I went to see Dr. Davidson, I had an elevated PSA count, which I believe is a prostate-specific antigen, which is an indication possibly of an enlarged prostate and even possible further, prostate cancer. So it's a key indicator of, I think, a higher at-risk individual.
If the PSA is very elevated and the risk factors are high for having prostate cancer, the real way to evaluate that's through prostate ultrasound and biopsy.
Anytime I think someone recommends a biopsy on you, there's always a few nerves that go with that. But Dr. Davidson had done a great job in talking me through the procedure ahead of time and knew what to anticipate. And truthfully, it's not the most comfortable procedure to go through, but it certainly isn't the worst. And it's over in the course of about probably 15 minutes.
In this case, the biopsy proved to be negative, but he continued to have escalating difficulties with urination, getting up at night, slow stream. At that point, when the medications were no longer effective and his quality of life was being adversely affected by this, he elected to proceed with a minimally invasive procedure through a cystoscopy and laser prostatectomy. That allowed us to remove the obstructing tissue in an outpatient procedure, very low risk, and I was able to return to a normal voiding pattern relatively quickly.
He's very professional. He runs through all the different options and possible outcomes. Very happy that I'm under Dr. Davidson's care. I feel like he's keeping a watchful eye on my condition, and we see each other about every 6 months now.
The elevated PSA has no symptoms, and that's why screening is so important. You're not going to know that you have an issue there unless you check for it.